What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. Today's video, we're covering best way to handle confrontation with doctors as an X-ray tech. So to give you context, I'm an X-ray tech. I do night shift and a lot of day shifts since I do work overtime. So me personally, I'm a very calm, chill, laid back tech. So like very few things will get under my skin, but I will say that apparently certain techs that I've worked with maybe have gotten confrontational with certain doctors, which I see more of the night doctors are more chilled and laid back compared to some of the more day doctors. Because like in the daytime, we've as a department had more issues. I don't think we've ever had any problems at night. Maybe occasionally like the online radiologists, but besides them, like in-person confrontation, I would say it would be mainly either in the emergency room or it'll be some doctor that will order something for like patients on the floor. That's where we'll have the problem. So my best advice is to, like, usually what happens is the doctor will start disrespecting the tech. Usually that's what happens, and they'll like be like, what kind of X-ray tech are you? Where did you go to school? Like, usually it'll be because like your image isn't that like isn't optimal, or it's not to their standards, or like something like that will usually kind of pop off. Or like maybe the patient's being like kind of aggressive, or like the tech is hesitant to do the exam, doesn't feel comfortable, and like the doctor will get mad. Or like, so usually it's nothing major, it's just kind of something simple that will usually trigger off a doctor since they're already stressed half enough. It's like usually like what I've seen that usually helps is kind of like always try to stay calm. And like the sad part is for a doctor to get fired, it will take like they will have to mess up pretty high, or like there's like several levels that they have to go through for the hospital to get rid of a doctor, compared to like a nurse or an X-ray tech. The sad part is we're like slightly more replaceable than the doctors, like correlationally. There's more of the like nurses, X-ray techs, all the other ones compared to doctors. So like I've seen many times where like the doctor will just get like a warning, and other times there's been techs that have gotten fired compared to getting warnings, which there are like ways they'll do it. Like you'll get a warning, you'll get this, but depending on the severity of the issue that will happen, the warning or whatever will vary. But usually just try to stay calm, professional. I've seen surgery. The surgery doctors are pretty bad. That will just like, they feel a sense of entitlement, like they're the best, which I mean they're doctors, so they're up there, and it's so hard to become a doctor, so they feel like, you know, they demand excellence or whatever. So I would say just try to stay calm. Don't start arguing, fighting with them. Just kind of stay your calmness, because once you start batting back and start, you know, with your mouth, then it kind of becomes an issue where it's a he said, they said, the doctor kind of holds the power type situation, unless there's other people with you who witnessed it and are willing to say something. Because other times there's like stuff happens and like no one wants to say nothing because they are afraid they'll get in trouble or involved. So it's kind of an iffy situation. And there's been times where even other doctors will see people getting in this type of way, and then something will happen, and the other doctor will be like, I can't confirm nor deny that I saw anything, because they don't want to get involved. So it's kind of like an iffy situation. So me personally, I would just stay calm, be like, okay, yes sir, whatever, apologize, just keep it calm. leave the area or finish your job and do whatever, kind of leave, and then just speak to your supervisor or to the head of radiology, like, yo, this is what happened, da 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 da, and then kind of let them handle it and let them escalate and see what happens. Like today we had some situation where one of the pictures was not optimal. So like one of the doctors, the surgery doctors, got mad that it wasn't perfect, that it wasn't straight, it wasn't a perfect lateral, because it was off by like a slight, like it was a smidgen that it wasn't lateral enough. And then, which, like, our manager looked at it, he's like, there's nothing wrong with this picture. Like, okay, maybe it's not completely lateral or whatever, but like there's been times where even he sent worse images, and like the rad and everyone else has been fine. So like sometimes there's certain doctors that are more picky than others, and it gets kind of iffy in gray field. So I would just kind of just like stay calm, because it's so easy in our field for us to either get in trouble or lose our licenses compared to if you were in other professions that were not in the medical field. So that's something to be aware of, because usually if you burn your bridges in one field, they'll kind of like ban you, or depending on the severity, you can't pursue other medical careers, especially in certain states. So yeah, it's been your Miguel. See you on the next one.